I am Dr. Shannon Kuruvilla, and today we're having a conversation I believe that more women deserve access to, one about comfort, confidence, and body awareness that often goes unspoken. We are talking about labiaplasty, what it really is, why women consider it, and how it can change not just the way your body feels, but the way you feel in your body. My guest today is a lovely, real patient who wanted to share her story privately and anonymously, which I completely respect and deeply appreciate. Her courage to speak openly, even without her name, is what will make this conversation so valuable for other women who are quietly wondering if this could help them too. So we'll just get started right off the bat. Can you tell me a little bit about what made you start thinking about labiaplasty or even researching it? Was there a particular moment or a frustration that made you realize you wanted to explore your options?
Yeah, I would say I probably noticed that I was a little bit different in terms of I refer to them as my flower petals. I always said like petals are different shapes, so I always
Yeah.
kind of noticed that my petals, so to speak, were different than my friends. Probably around like my freshman year of high school, like around the time you hit puberty, you start wearing like more like bikini swimsuits and things like that. I had a pool growing up, so I was always in my swimsuit. We were always in the pool, and I never really noticed that until my friend had made a comment my freshman year, or like going into freshman year, that I noticed I was a little bit different than everybody else.
Got it. I feel like everything just like happens during the most cruel years of life, like
Yeah,
middle school, high school. Like we have all
I
these.
know. It's like, thanks so
Yeah,
much for that
sick.
tidbit. I'm so glad I can do so much about that
Yeah,
right now
yeah, exactly.
in high school. Yeah.
And I think that a lot of women, I don't know if this resonates with you, but a lot of women feel like the only one who has this or like feels this way. Did you ever feel like that kind of isolation?
Yeah. I mean, I definitely felt isolated because, like I said, my friends, they weren't shaped like me.
Yeah.
And, you see like people say like obnoxious things, not directly to you, but in terms of women's anatomy, which I think is just disgusting that people even feel it necessary, especially men, to talk about a women's anatomy in that aspect. But I think someone had said something like, or I had read something online, someone was like making fun of women's anatomy down there and it had compared it to like some type of meal or food or something like that. And I remember specifically that moment. I was probably like 16. I cried. I saw, it's not they were saying it to me, but it felt like it was being said to me. And it's like I felt so ashamed of just my body, which is crazy. You should always feel comfortable in your skin. But this was just always kind of like a cloud, like a dark cloud in terms of my mental wellness, especially as I started coming into the age where I was physically active and I was having, partners, things of that nature, when, you're very self-conscious about that stuff.
Yeah. Before your friend made that comment or you heard that, disgusting comparison, did you ever feel discomfort and you were just like, oh, this is just how my body is and you would like compensate for it? Or did that come later, like with clothing and exercise and stuff like that?
I feel like definitely clothing, like middle school is when I noticed like, okay, it's a little uncomfortable.
Yeah.
You hear the dreaded word granny panties as a child or when you're in school. And so you feel like, oh, I have to wear these other types of underwear. And so, I tried to assimilate and I got a pair of the underwear that, all my friends had. And it just was immediate discomfort. And I'm like, when I wear these underwear, it looks a little bit different than when my friends are wearing these underwear. And so I think that's probably when I noticed in terms of like the feel of the discomfort when wearing underwear or wearing anything restrictive. I would notice that, and it would be like constant adjusting, or I had to, stand up and move. And, people might have thought, oh, well, this girl's very antsy. She's always moving, but it's like not so much being antsy, but I'm trying to keep my circulation here, because it can be very uncomfortable.
And so frustrating because it's like, there's such a taboo topic, like you can't explain yourself and you just kind of have to keep it to yourself. And I guess that leads me to my next question. I know that you have the most lovely, supportive partner now, but back then, was there anybody that you felt like you could talk to about this, or even like a doctor or a family member or a really good friend?
I had like made comments about it to my mom at a point where, she always told me, it's okay to love yourself how you are. There's nothing wrong with you. I definitely believe like while she meant good, there were some seeds that she might have planted in terms of doubt. Like, okay, this is going to change the way you feel. You're not going to be able to feel the sensations that you would feel before. There could be, there's all of these like what ifs, but the positive heavily outweighed the internal, well, what if this doesn't work, or what if it doesn't feel right. Or what if I'm unhappy with it? It was all heavily outweighed by, okay, well, that's going to improve my quality of life. It's going to improve my confidence. It's going to help me feel more sanitary, especially during like my cycle, things like that. Because when there's more skin, there's more things you have to clean. And that's not necessarily always the easiest thing to do, especially when you are in meetings all day, you're working in the office, or you're commuting. It's not 100% accessible all the time to just be able to go and, clean yourself the way that you feel. Well, at least the way that I felt I needed to be sanitary. It was always a challenge.
Just things that would never, people just take for granted every single day, like was, your real experience of just an added, I don't know if inconvenience is the right word, but just another thing to have to take care of.
It was an inconvenience, honestly. It was, because it would get to the point, like, I don't want to be like overly graphic, but like, where you'd have to like tuck it to the side or push it behind. And it's like, I didn't love that. That wasn't, like my favorite thing to do. I mean, I did it because I knew I needed to just adjust so that way I could be comfortable in my own skin. But it just got to the point where it was like, it just was negatively impacting my day to day, both physically and mentally. And when you have both of those together, it can be a doozy.
Huge burden. Yeah. And like we have enough to worry about when we are middle school and high school age girls in this world.
Yeah.
When did you kind of have like a serious thought about if this could be surgically corrected and consider consulting with somebody about it?
Labiaplasty has always been something that was in my vocabulary.
Okay.
From the time that I learned about what it was and that it was an option, and that there was other people like me and other women that were afraid to take the next steps to improve their just overall quality of their life, especially if they were, like I said, the pedal, I call them pedals, right?
I love that.
Pedals are different lengths, right? And so for me, mine was at a point where it was like, I have to do something at this point. And so I was like, okay, I'm 35. I'm getting to the point where those next steps in my life will be going through, perimenopause, and things are going to change. And I would rather, nip it, so to speak, before it starts evolving into its next shape.
And be honest, you're not going to hurt my feelings at all or anything. Was I your first consult, or had you seen other consults before?
No, you were my first one.
Was that? Okay.
Yeah, it was actually very spontaneous. I was just sitting there with my husband. We were eating dinner, and I was just like, I would really like to have this procedure. And I think my husband's always known that it's bothered me, and his support was absolutely the encouragement that I needed to make that phone call.
He's so wonderful.
It was just so supportive, so patient, so kind. His encouragement gave me the confidence to even just kind of call and just get an idea, right? I was like, okay, maybe I won't do the surgery right away, but it's not going to hurt to at least go in and get the information. So that way, at least when I do make that decision, I have all the facts and I have a resource available that I can use. And then I think from the first time that I called and just being greeted by the front desk team, you guys have cultivated such a warm environment here. I think that really translates well, especially to new clients or new patients. Being in a plastic surgery industry, it's natural for women to feel some type of way about the way they look. And so I'm like, okay, I'm going into the bullpen. Really, they're gonna look at me and they're gonna be like, oh my gosh, we got to get rid of this, we got to get rid of that, chop it all off. Definitely that wasn't the case. It was much more reassuring and calming. Like, you're not the only person that has been like this. We've done procedures like this here before. There's really great successes. And I did do some initial research as well prior to actually calling, just kind of reading about the practice and customer experiences and overall their contentness with their procedure. And I was really pleased with what I saw. And
thank you.
Then, from the, like I said, from the time I had that, just the phone call, I felt so comfortable with the practice that I made that in-person consultation instead of just calling and getting info. I was like, you know what does it hurt? Let's just book it. And I'm so glad that I did. And, that was like the first step towards just an overall better quality of life for me.
Good. Thank you. Okay, so getting to the consult, I think a lot of women are wondering what that will look like the day of your consultation. So I'm going to walk through that. And then if you don't mind, just like kind of chiming in if there's anything I leave out.
Yeah.
So when you come for a consultation at our clinic, we give all of our patients the same form to kind of go over your health history. We really want to know medications you're on, kind of like your social habits, smoking, drinking, of course, as it relates to your particular surgery, like if you've had kids, and also just kind of your overall support system. So that will get filled out. And then you will meet with one of our lovely patient care coordinators, and they just kind of review your history with you, maybe fill in any gaps, and then kind of go over like nitty gritty about like your surgical goals. And then they come and report back to me. And then I think during that time, you change into a robe.
Yeah.
And then we both go in together. So it's still me and the patient care coordinator that you've met, as well as any family members that you bring. And then I usually review a few kind of just important things about history that I like to know. It just helps me from like a safety standpoint for surgery and like see if there's any medicines I need to prescribe in particular. Part of our history and physical, the reason we get all of your past medical history is that, there are common diseases that can affect our private areas. So usually the most common one that I hear about from my patients is herpes. And if you have herpes, it's no problem at all. You can still very much have this procedure. I will prescribe you a prophylactic dose of your Valtrex. Usually you already have Valtrex and you kind of know how to handle it. I just don't want any open sores at the time of surgery. And then just other STDs, I just like to be, well controlled. You're on medications, and whatever levels of like vital counts or anything are all being monitored by a physician and are under control. The stress of any surgery can cause, and a sore, especially like for the herpes. So that's why I have you take that prophylactic dose. There are some conditions that might require you to be on steroids. And that's just important for me to know just from a wound healing standpoint, because that can affect kind of the strength of your scars, but we do things to adjust for that. So nobody should feel like they're excluded from this procedure because of any medical comorbidities they have. And that includes any sort of sexually transmitted disease. And then I always use this phrase that I learned from a surgeon in San Diego, Dr. Kat Gallus, and she says it's a spectrum of normal, right? So there's not like a specific anatomic look that is anatomically normal. It's a spectrum. Yeah. And I like to hear exactly what it is that bothers you about it, how long you've been thinking about it. I also will ask sometimes, I think if there's like some redundancy to like the clitoral hood, because a lot of times those two procedures are done together.
Yeah.
And then I think I usually say like, okay, I'm going to jump to the exam now. Are you ready for that? Are you comfortable? And you're in a robe. And so I will usually kind of lean you back into the chair. I do have you do like a butterfly position that I think women who have had kids are probably familiar with, where you just kind of like butterfly your legs out. And then I will dictate kind of some of my exam findings to my patient care coordinator, who usually isn't looking. They're sitting at a desk and taking notes. I don't even think they can really see, but it's like important to have chaperones in the room.
Oh, yeah.
And usually I will take a ruler and do some measurements. There's a few ways to describe the type of hypertrophy, like if it's like the prox, like the upper third, middle third, or lower third that's enlarged. And then I just kind of like describe my exam. I think that's it for exam. And then I just have you kind of close the robe back and we review the plan and go over kind of risks to the procedure.
That's exactly how I remember everything. Very good experience, I will say, with my client coordinator that I had. I can't recall her name at the top of my head, but she was very patient and very calming and reassuring that we would figure out everything we needed to in terms of the scheduling and the payment and all of that. I'm a natural learner. I want to know the ins and outs of everything and how things work and how, I want to give me the details. That's kind of just how my personality is. So you were very good at communicating that information to me, saying, okay, women can range when they I think you called it hypertrophy or something like that.
Hypertrophy. Yeah.
Hypertrophy. Okay.
Yeah.
I still said it wrong, but
I like it.
You had said that can vary in terms of how long or how many centimeters. Mm-hmm. And so when you explain that and you're like, okay, so here's where you're at, I was like, wow, I'm at this length and I feel so uncomfortable. I can't imagine being even longer and struggling with that. And, you don't feel as womanly because when you think of a bulge down there, it's typically a male anatomy, not your female anatomy.
Yeah. I feel like you've kind of like echoed like my philosophy. Like I feel like information is power. And
Yes.
like
Yeah,
even
that's
if
what we're saying.
patients come to a consult and like even if they don't book, like I do feel like I've somehow helped them by giving them, some information and also maybe
Yeah.
validating their concerns.
Yeah, exactly.
Okay, cool. That's very helpful. Going into the day of procedure, what were your biggest fears? Like I know you said you were way nervous the day before and morning of.
Yeah. My biggest fears were not so much the procedure itself, because I thoroughly, like, I'd even watched, gone on YouTube and I was watching not specifically anything that you had done, but just the
Yeah.
process, the procedure in itself, so I could learn just as much as I could about what to expect. Your office was very, very good, I will say, about being very clear and transparent about what to expect in terms of healing, which was really helpful for me to have a realistic frame of reference.
Thank you. And I think like my goal, I guess my primary goal or hope for this podcast was that I feel like people hear labiaplasty under local anesthesia and they just like cannot grasp that.
Yeah.
And I can understand why, like, as a consumer or like the patient, you're like, well, you're the doctor. Of course, you're going to tell me it's not bad. Like, of course, you're going to tell
Yeah.
me that I can handle it, but like, can I really handle it? So I was
Yeah.
hoping you could kind of walk me through and you could be honest, like, parts that were painful. If you had to do it again, were you okay with under local? Would you prefer under some sedation? And like, kind of how did it compare to what you expected?
Day of, like, there really wasn't anything that stood out to me negatively in terms of like, oh, I don't know if I could ever do this again,
Okay.
because 100% I would do it every time in any timeline. I wish I would have done it sooner.
Yeah.
There really wasn't anything I can think of that made me feel uncomfortable
Okay.
or made me feel scared or unsure or uncertain. I had full confidence in what you were going to deliver. And I knew that I could feel your passion as a provider, being a medical provider, that's something you enjoy doing. And I think that's important when you do find a surgeon, is someone that truly enjoys their craft and making people truly feel better in their skin. I think that helped ease all of my kind of like my mental fears.
Yeah.
In terms of physical, like I said, I kind of was like, oh my gosh, they're going to cut this piece of me off. That's kind of always been part of me. And, I had silly thoughts like, do I bury it? Do I have like a little funeral
We
for
should
it?
have we should have had a ceremony.
Yeah.
Oh man.
Goodbye. It's like, and so it's just like, you think, oh gosh, am I going to be okay? Am I going to be so sad when it's gone? Because it's a part of me is missing.
It is. Yeah.
And no, I can confidently say I don't feel sad that it's gone.
I feel like there was a moment where we like showed it to you and you were like, bye.
Yeah, no, I did. I definitely, like I said, I want to know the details. So it would not have surprised me if I was like, can I see what's over there?
Yeah, you definitely.
And then just seeing it, I was just like, oh my gosh, like all these years of discomfort, all these years of like shame, not shame, but like embarrassment. Because I'm not ashamed of who I am. I just was a little embarrassed by it.
Right. There's a huge emotional component to this thing that you've had your entire life and you've been thinking about doing this your entire life. And maybe it always felt like this like far off, like nebulous time. And like, here it is, it's happening. Last thing kind of about the day of procedure, and like, don't be afraid to be 100% honest, because this is what this is for. I want patients to hear it. I do the topical numbing medicine. And then I do that initial needle stick with the local. Did you feel that needle stick? Like, what was that? Okay.
Yeah, I was actually pleasantly surprised. Like, not
Good.
that I thought it was like this big, huge needle. Like I said, I've had epidural, so I have no needles. But this really was not even like the topical numbing did such a great job. Did its job so well that I didn't even feel those pricks.
Okay.
What I do remember is you were very vigilant about, do you feel this? Do you feel this? It wasn't like I'm just going to give her this numbing and I know she won't feel it. I'm not going to check on her. She's good to go. It was, do you feel this? Do you feel that? We're going to check here. We're going to check there. So it was a pleasant experience in terms of preparing for it. I didn't have any pain at all with that. No even pain. A little
Nothing.
bit. Yeah. Like it was.
Okay. So the actual procedure itself, you didn't feel any pain. Okay. I think that's huge. Like, I think that's really huge for patients to hear.
Gosh, I physically and emotionally felt so much lighter.
Good.
Once I knew it was gone.
Okay. And then moving into recovery, I know that I feel like maybe day one, you were like, okay, I'm feeling it. Like, can you kind of, I guess, walk through the recovery and how that discomfort compared to like what you were expecting and just for patients to understand?
In terms of pain, I really didn't feel anything that first day because, the numbing agent that you used, I think there was like a topical one, and then there was also like a long lasting one that would go throughout that 24 hours. And I'll tell you that at least for me, it made it, I don't know if it makes a difference for everyone. I mean, I've only had this surgery one time.
Yeah.
But I can tell you that I didn't have a lot of nerve pain.
Okay.
I think there was really only one point where it was like a little uncomfortable, a little itchy. And that was when the stitches were really starting to heal and getting, I think there were dissolving stitches.
I do dissolvable
was
stitches,
around that time that they
like day 7 or so
started to dissolve. And I was like, okay, it's a little bit of an itch or a little pinch here or there, but really nothing substantial.
I think that's super reassuring for patients to hear, just that recovery is smoother and more manageable than they expect, especially because I think we really try to individualize our recovery protocols.
Yeah.
And I think like people might ask, like, why would you do this under local medicine? A, cost. It's cheaper to do that than under general anesthesia.
Yeah.
B, I do have a lot of patients who just don't want to tell anybody that they're having this procedure. So they want to drive in the day of and drive home afterwards and just have it be that private experience. And I would like to say that while we do perform the majority of these under local numbing medicine, if that is too anxiety provoking for the patient, we can absolutely offer it under general anesthesia, light sedation, or I just prescribe you an anxiety medicine to take the day of surgery. I think you might have taken that just to kind of take the edge off. Yeah.
I think you gave me it was something that I had to have someone drive me and take me home.
Yeah.
Because I was taking that. It was like another layer of cover. I'm glad I did that too, because I was a little, like I said, I was nervous. But,
understandably so.
Simmered down quite a bit once I got here.
And then you've already shared this, but like you have had an increase in comfort level in your appearance since the surgery. I remember even maybe like I don't remember what appointment was I saw you in, but you're like, I've already been wearing a swimsuit and I can like tell there's no bulge.
Yes,
or like,
oh my gosh.
Yeah.
After you have a C-sections, our bodies change. And I don't always like to show my stomach, but I still want to look, attractive or sexy if I'm having intimate time. And so I will wear these one-piece things. They're teddies. I think that's what they're called. They look kind of like swimsuits.
Yeah, yeah.
And I always loved them, but I was always afraid in the past, like taking like if I were to take a picture or stand a certain way, that my anatomy would fall out and hang from the side, and I would hate that. And so I never wore them. I loved them, but I never got to wear them. And then I remember after I'd fully healed, I tried one on and I was just so shocked. Like it was just like, it's not there anymore.
Yeah.
Like it's gone.
You could just be carefree finally.
I don't have to worry about like adjusting it or moving it or cutting circulation off. Like I can wear these things. It's flat. Like it's a flat. It's not bulging there anymore. And it just immediately made me feel a lot more feminine.
And just like a new kind of type of freedom, I'm sure too. Like it's just no longer a concern anymore.
Yeah. It really opened up my options in terms of being able to wear more athletic wear, which will in turn allow me to be able to exercise more because I won't have to, strap everything down just to get some movement in. It's just, I can walk now. I can walk longer distance.
Wow.
That to me was one of the biggest things is I can't walk that long because after a while it's going to start twisting and moving and shifting. And it's not like I can just be like, hang on guys, let me just adjust this real quick in the middle of the field or the trail. Like, wow. I couldn't do that. And so I found myself not going or saying, I don't want to go. Y'all go ahead without me. Now I don't have to miss out on things that I love doing because of how I'm shaped.
So this has just improved your health from like a mental health standpoint as well as a physical health in terms of like increased activity levels and exercise, and
it's all connected. Whether we're blatantly aware that is connected or not. For me, it was just like this, I don't know, like paradigm shift that wow, it doesn't have to be discomforting. You don't have to be in pain all the time anymore. Yeah. Like, why did you wait so long? Why are you so afraid? I'm so glad that I did this.
If another woman is listening and quietly thinking, that's me, what would you want her to know?
Don't be afraid to take the next step towards a better life for yourself physically. If you're thinking about it and it's something that's bothered you or you felt shamed about it, don't feel shamed by it. Use that as fuel. Use that as motivation. Use my words as motivation to have that procedure done because, like I said, my only regret is not doing this sooner. Like I can only imagine how like my early 20s would have been had I
Yeah.
gotten this done earlier.
Yeah.
Any last tidbit of encouragement is if you're even considering it, if you've even considered having this procedure, maybe you didn't even know that this was a procedure that you can get, and now you're like, oh, I'm going to look it up. Do it. Look it up. Check it out. Make it that consult. It doesn't hurt to get the information.
Yeah.
And I promise you, your life will be so much better if you do proceed with making that change for yourself.
That is beautiful. And I can't thank you enough for being so brave to talk about this. And I don't think I can convey like the honor that I feel that you picked me to help you get through this. And yeah, I guess I'm kind of speechless. So I really appreciate that.
Yes.
And I know that a lot of women listening to this are going to feel less alone because you have been selfless enough to talk about and tell your story today.
Yeah.
I hope that they feel more empowered. So if you are listening and want to learn more, I always say just start by getting information, which you already that was the theme of this episode. Thank you again so much. I really appreciate it.
Absolutely. Thanks for having me.
Basu Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. To learn more about the practice or ask a question, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, TheAxis.io.